Good morning, my name is Monique Keller and welcome to the second part of Gait and Ambulation Mobility Aids. The following objectives will guide you through this lesson. You should know the various types of mobility and walking aids. Be able to teach a patient how to walk safely with the mobility aid. Apply all safety precautions before and during walking a patient by using mobility aids. Then you should also be able to test the balance both in sitting and standing to make sure that the patient is ready to start walking safely. You should know and be able to measure the following mobility aids to fit your individual patient: canes, crutches, and walking frames. Should know the different gait patterns and also be able to teach the most appropriate gait pattern for that patient. As a revision, the various different walking aids, or as we call it, mobility aids as well, here you can see on your left top you have a gutter crutch. Next to it, to its right, is a cane quadrupod where it has 4 legs at the bottom. Next to it is a crutch, and then to the far right, the top of the slide, is what we call axillary crutches because they fit into underneath the axilla. The bottom left is a walking stick or a cane, but known to your patient will know it as a walking stick. Next to it, a walking frame. And notice how it has got the rubber tips on the walking frame, where the walking frame to the right of that one has got wheels in front. So you can imagine that it will, for somebody that hasn't got the strength and often the balance to lift up the walking frame and put it forward, the walking frame with the wheels on will make it easier for them to walk. So let's go into how you will walk a patient with a walking aid. So it's always good and necessary to explain what's going to happen. Often there is fear and uncertainty in your patient, and you always want to communicate very clearly how and what is expected of them. So you'll first have to explain in words, then you will have to demonstrate to them, then you have to teach them again. Thereafter, check their balance in sitting and standing, measure the walking aid to fit them perfectly, and then they walk. So let's go through this point by point. General interaction with your patient, very important. Prepare the area. How do you do that? Is you put a chair halfway the distance that you have decided to walk. Let's say it's to the door of the room or the cubicle. Then you will put a chair halfway, and to make sure that if they want to take a rest, that you don't have to leave their side, but you can simply say, let's just walk to that chair. That's our first goalpost. Check safety of the walking aid as well. Make sure that it is steady, that the rubber tip on the end is still fine, and that it is safe. screened for the necessary safety aspects and contraindications of their condition before you start. For instance, don't let them walk with socks on because they will slip. Make sure that the floor is not wet where they walk. Are they walking with slops, flip-flops, where there's a chance that it's not as secure or they may fall or slip? Be sure that there's the area where they're going to walk and your patient is safe to walk. Check the balance in sitting and standing. Explanation and demonstration of the technique to the patient. So teach them how to go from sit to standing with their walking aid. Will their one hand be on the chair and the other hand on both crutches? And then they stand. How will they move from standing back to sitting? Also teach them how to turn with the walking aid. Thereafter, if they are safe, you feel that you have educated them well enough, then you start walking. Remember, if their balance is not good, then the parallel bars can provide a safer area for them to walk in and to gain the necessary balance and strength. Where will you stand? You, as their physio, has to keep the patient safe. So you are always just behind and to the side of your patient's weaker side. So posterior and lateral, your hand always close to the lower back, one hand slightly in front of them so that if they want to fall to the one side, that you can quickly grab hold of them and keep them safe and upright. So one of the therapist's hands is placed posteriorly on the patient's back and the other in front, but not touching the patient's shoulder on the weaker side per se. You will see what they need while you are in that position. Now let's go through the safety precautions. Before walking, you need to make sure that the patient is medically stable, that you will pick up in the medical records or by asking the sister, the staff in the ward. You will also be able to pick it up by observation and of course reading through the notes in the file. Socks should be off, proper shoes on, drips, catheters, you should take care of them while walking if they are still in situ. You will have to help to carry or push the drip stand or take the drip bag off and securely walk with that as well as the catheter. Always be sure to wear gloves whenever you are working with your patient, and also because you don't want to touch catheters with bare hands. So PPE on. Circulatory prep. So you're going to ask your patient to move their feet, do some foot pumps, move their limbs, get the blood flowing, after which you will check their balance. You're going to test their balance, make sure. Ask them if they are dizzy, and you can repeat this a few times throughout walking with them. Always ask them to open their eyes when they stand up to make sure, because you can actually pick up in their eyes if just before they faint, so that you can immediately tell them to sit back down. Have a chair ready, or even ask somebody that's in the close vicinity, if you are concerned, to just be ready to bring you the chair that you have placed close by. know their weight-bearing status. What that means is you have to find out if they are allowed to put their full weight on the injured leg or only partial weight on that leg, or if they should actually not put any weight on that leg, and that is called non-weight bearing. Further safety precautions: check the strength of the weight-bearing limbs. Explain clearly and then demonstrate what is expected of your patient. Make sure your walking aid is safe and intact. Some walking aids are very old, or the rubber tip at the end is worn out and the actual crutch is sticking through it. Make sure it is safe and intact. Take a look at the general condition of the walking aid. The ferrules are the rubber tips on the end, the bottom of the crutches, the walking frame, and certain canes. Make sure they are not worn. And also prescribe the correct walking aid. Make sure the type fits your patient. So for a fit, strong 18-year-old, you are not going to give him a walking frame. He's going to laugh at you, and he actually will cope better with crutches. And you should be able to correctly show them how to use it. So be sure to give clear, concise instructions. The crutches should be a matching pair. So make sure they match, and you can often pick this up when you measure it according to the patient's specifics, where their greater trochanter is. There you can often pick up if it's not the same matching pair of crutch. The one is slightly longer than the other. Because you don't want to issue a mismatched pair. This often happens when they've brought their one crutch from home and they only have that one, and you order another one. In that case, you will make the best of the situation, of course. The spring tips are located on into the hole, so you will see that you have to press that spring clip in on the inside of the crutch, and you will then be able to, with your one hand, pull out the bottom of the crutch out or in to make it the correct height. For auxiliary crutches, make sure the nuts and the bolts are tight. So these spring clip tips and nuts and bolts should be tight before you start walking. And also, with elbow crutches, the adjustment mechanism should adjust freely. It's not always the case where you actually have to really push hard on the spring clip tip, but it should actually adjust freely and easily. How do you test balance? So here I've given you some resources, and I will also upload videos so that you can watch it and practice it at home to really be able to test balance well. But these are only a few basic tests. You will learn other balance tests later on in the year. So you will here find resources for testing sitting balance, where you will ask the person to reach and do rhythmic stabilization, then sit to stand with crutches. How to do it is also a resource. Then standing, testing balance in standing by asking them to reach, then change the base of support, so feet first wide open, then shifting your feet closer apart, You will also be able to watch it when you go click on these YouTube links, or you can copy it, paste it into your browser. From this point on, we're going to go into specifics with the various types of mobility and walking aids. Here we are going to look at canes. So the function of using a cane is to widen the base of support and to help with balance. Patients are instructed to hold the cane in the hand opposite to the affected side. So if your right leg, knee is very painful, you're going to hold the cane in the left hand. A standard cane, the advantage is that it's not expensive. It fits easily. You can walk on stairs with it and other surfaces where the space is cramped. So for instance, if they have to get a taxi to the hospital, a cane is very small and it takes up very little space compared to a walking frame. The disadvantage, however, is that it's not adjustable and must be cut to fit the patient if it's like a wooden frame. Some of the metal canes or the quadrupod canes, of course, you can adjust them. The point of support is anterior to the hand and not directly beneath the hand. Another disadvantage, but through clear instruction, you can teach your patient to walk safely with a cane. So just in theory, how do you adjust an aluminium cane? The advantage is that it's quickly adjustable, it's lighter, and it's easier on stairs, like we said. But the point of support is slightly anterior. So, adjusting the aluminium cane, advantage is that it allows pressure to be borne over the center of the cane, which gives you greater stability. It's quickly adjustable, lightweight, fits easily, but the disadvantage is that it's more costly than standard canes. Here we are continuing with the different canes, the advantages and disadvantages of each one. Here the quadrupod cane, where it has 4 legs, often used for patients who had a stroke, cerebrovascular incident. The advantage of this is that it provides a broader base of support. The base is available in several different sizes and it's easy to adjust. The disadvantage is that the pressure exerted by the patient may not be centered over the cane and may result in complaints that they feel unstable. It's not always practical because you can't put this quadrupod on a step or stairs when you go upstairs. If it's one step, that's perfect, which warrants a slower gait pattern. When you look at a walking cane, the advantage is that it provides a broad base of support and are stable, more stable than a quadrupod cane. They also fold flat for travel or storage. Disadvantage, however, is the design and the hand grip may not allow pressure to be centered over the cane still, which we've seen in different canes as well. And also the challenge with climbing stairs. This also causes a slower gait pattern and often are more costly. Can you name the various canes in this PowerPoint slide? Who can tell me where the standard cane you can't adjust is? Yes, it's on the bottom right side. And where's the quadrupod cane? Can you pick it out? Yes, of course, it's at the top left with the 4 legs. And then the adjustable walking cane made out of aluminium. Can you see it? Yes, you can spot it on the top right side where it can be adjustable. And also then the cane on the top left where it's not a quadrupod, but it's also made out of aluminium. In a standard cane, you will find that the hand grip are often beautifully styled in different sizes, out of wood, and you will find very interesting canes, different types of hand grips. But when you measure a cane, be sure that you use the following points to measure it for your exact individual patient. So it should be 15 centimeters to the lateral border of the toes. The top of the cane should come to approximately the level of the greater trochanter. And when you have placed the cane 15 centimeters lateral to the toes, and the top of the cane is at the level of the greater trochanter, the elbow should be flexed to a 20 to 30 degree angle, so in slight flexion. Then you know that that is the correct position and measurements for your patient. So how will you instruct your patient to walk with the cane? Which gait pattern will you use? So we've now already determined that the cane will be held in the hand opposite to the affected side. If you have both legs painful or weak, then you will have to make the call, but which side needs most of the support? If it's the right knee that is very painful and weak, you will then place the cane in the left hand. Then you will give the instruction to move the right leg, affected leg forward, or most affected leg forward, while simultaneously bringing the cane in the left hand forward. So you step forward first with the cane and the affected leg simultaneous. Then the next leg follows. We now move on to crutches. Crutches are used most often to improve balance, take off some weight from the injured affected side, either taking full weight off or partial weight, also assist to increase the base of support, improve lateral side-to-side stability, and it allows the transfer of body weight to the floor while maintaining a restricted weight-bearing status. Moving on to the different types of crutches. Let us start first by looking at auxiliary crutches. It is made from lightweight wood or aluminium. The advantage of walking with auxiliary crutches is an improved balance and natural stability, and it provides functional ambulation while restricting the weight bearing on a leg. The disadvantage, however, is that it is quite awkward in a small and crowded area. Therefore, safety can become compromised. Also because the auxiliary crutches are underneath the axilla. That is where various nerves, axillary nerves, run, and vascular structures as well. And when the patient uses axillary crutches incorrectly and leans on them with the upper body too much, it can compromise the neurovascular structures, which makes education and teaching how to use axillary crutches of utmost importance. Gutter platform crutches is another type of crutches. The advantage of this is the forearm cuff, where your forearm rests on the crutch, allows use of the hands without the crutches. It's easily adjustable and allows for functional stair climbing as well. The disadvantage is that it provides less lateral support and is difficult to remove and more costly than wooden axillary crutches. How to measure crutches to fit your patient's body specifics. First, axillary crutches. It can be measured either in standing or when your patient is lying in supine, on their spine, facing up. In standing, for instance, in parallel bars, take the following measurements and use this. So, 5 centimeters below the axilla, 3 width, that is how much space should be between the axillary fold and the top of the crutch. The distal end should come to a point 5 centimeters lateral and 15 centimeters anterior to the foot. So what this means is that when you are standing, place the bottom part of the axillary crutch 5 centimeters lateral to the foot and 15 centimeters anterior forward. Then you position the arm piece under the axilla, and then there should be 3 fingers space still between the axilla, armpit, and the rubber part in the axilla. A general estimate that you can also use is to subtract 40 centimeters, 40 centimeters from the patient's height. So you can use this as well, and so height minus 14 centimeters, and that is how high the axillary crutch should be. That's a general estimate, but the shoulders should be relaxed and the hand placed piece should be adjusted to provide 20 to 30 degrees of elbow flexion. What this means is shoulders relaxed is that if you pull your shoulders up to your ears, that will change the height and the setting of the crutches. So instruct your patient to relax their shoulders while you are adjusting the length. If you decide to measure the axillary crutches in supine, take the measurement from the anterior axillary fold to a surface point 20 centimeters from the lateral border of the heel, and that will guide you with your measurements. How to measure for forearm crutches can be done in supine or in standing. So in supine, instruct your patient to relax their shoulders. Flex their elbows slightly to 15 to 30 degrees. Place the tip of the crutch to the end of the shoes. So tip meaning the bottom of the crutch to the end of their foot or shoe, what they are going to walk with. The ring of the elbow crutch where you put your hand in should be placed at about 3 centimeters distal to the elbow joint. That is where that ring should be positioned. The hand grip should be at the level of the greater trochanter or at the level of the patient's wrist with the elbow straight. Always check the posture in standing as well, with the tip of the crutch 15 centimeters in front and lateral to the foot, and then use this standing position to confirm the above measurements. So then make sure that the elbow is slightly flexed, and then ask the patient if it feels comfortable walking with it. When we look at measuring in standing, take a point 5 centimeters lateral and 15 centimeters anterior to the foot. Place the tip of the crutch, meaning the bottom rubber tip, in that position. Shoulders should be relaxed and handpiece should be adjusted to provide slight elbow flexion, 20 to 30 degrees. The cuff is adjusted separately. It is placed on the proximal third of the forearm, approximately a few inches below the elbow, as we saw when measuring it in supine. Here are examples of different types of crutches. Can you spot the auxiliary crutches, the gutter crutch, and the standard crutch? After measuring the crutches, you now have to look at the following before gait, before you tell them to walk. The body weight should be on the hands, not through the shoulders or under the axilla. For instance, in auxiliary crutches, maintain a wide base of support. When using auxiliary crutches, crutches should be held close to the chest wall to provide more lateral stability. If it's far away from the body, they may feel unbalanced and unsafe. Instruct your patient to hold their head up and maintain a good posture alignment. So chest up, look forward before they walk. Turning should be accompanied by stepping in a small circle rather than pivoting. This is very important because often, especially in total hip or knee replacements, we do not want any pivoting on that new replaced joint. So this comes in handy if you can get into the habit of teaching your clients, your patients, to step in small circles, in a round circle, and not to pivot on the spot. You will have the opportunity to practice this and also watch the videos that I'm including the links of for you to understand the gait patterns better. But let's go through it in theory. You have various different gait patterns, starting with the 4-point gait. The indication of when you will instruct your patient to use this gait pattern is if there's weakness in both legs or poor coordination. What's the pattern sequence? Left crutch, right foot, right crutch, left foot, then repeat. Left crutch, right foot, right crutch, left foot. So you can see that the 4-point gait means that at a stage while they walk, there are 4 points in contact with the floor. The points referred to here are the tips of the crutches, 1, 2 tips plus 1, 2 legs, left and right legs. 4 points at a stage will be in contact with the floor. Advantage of this is that it provides excellent stability, as there's always 3 points in contact with the ground, while your one leg lifts up. Don't get confused here, where I told you that 4 points at a stage is in contact, just before the leg lifts off. 3 points here is just used to tell you that there's always a better stability with using this gait pattern. The disadvantage is that it can be a little bit slow. Moving on to 3-point gait, what is this? It's indicated where there's an inability to bear weight on one leg due to fractures, pain or amputation, and if there's non-weight bearing status. So for instance, an ankle fracture where the patient is instructed by the doctor to not put weight on that foot. That means at a stage there will be 1, 2 crutches and the unaffected leg in contact with the ground, making it a 3-point gait. What's the pattern sequence? First, move both crutches forward and the weaker lower limb forward. You won't necessarily touch, but the limb normally moves slightly forward with a hip bend. Then bear all your weight down through the crutches and move the stronger and unaffected lower limb forward, and repeat. The advantage of this is to eliminate all weight bearing on the affected leg. A disadvantage is that good balance and upper limb strength is needed for this. What is a 2-point gait pattern? It's indicated when there's weakness in both legs or poor coordination. How does the sequence and the pattern work? So you place the left crutch and the right foot together forward. Then the right crutch and left foot follows together as well. That means that at a point in the gait pattern, there's always 2 points in contact. 1 crutch and 1 foot. What's the advantage of using this for your patient? It's a bit faster than the 4-point pattern, but the disadvantage is that it can be difficult to learn the pattern. If you have a pair of crutches at home, try it out and see which one is faster or slower, the 2-point or the 4-point gait pattern. Moving on to the swing through gait pattern, it's indicated when there's an inability to fully weight bear on both legs. There's a fracture, pain, or an amputation. The pattern sequence is as follows. Advance both crutches forward. Then, while bearing all your weight down through both crutches, swing both legs forward at the same time past the crutches. That's why it is swing through. Advantage here is it's faster, and it's the fastest of all 6 patterns. A disadvantage here is the energy consumption. It requires also good upper limb strength, so a high energy consumption and grade 4-5 Oxford upper limb strength is required. The final gait pattern is the swing to crutch gait. Indication for this is for patients with weakness in both lower extremities. The pattern is as follows. Advance both crutches forward. Then, while bearing all the weight down through the crutches, swing both legs forward at the same time to not past the crutches. So this is swing to the crutches. The advantage is that it's easier to learn. Disadvantage is that it requires good upper extremity strength. Now we will cover walkers as another mobility aid. It provides great stability, lateral and anteriorly. It improves the balance and it also takes some weight bearing off injured or painful limbs. It provides a wider base of support and it comes in several modifications. A folding mechanism where you can fold it up, store it, place it in a car or a taxi, hand grips, platform attachments, reciprocal walkers, casters, stair climbing walkers. There are many different types of walkers that you can find. But normally, climbing stairs with walkers is not easy and not possible. Advantage of using a walker or issuing a walker for your patient is that it provides 4 points on the floor and thus a wider base of support and stability. It also provides a sense of security. There are lighter and easily adjustable types, but normally they are a bit more cumbersome and heavier than standard crutches, for instance. The disadvantage is that it is cumbersome. It's awkward to get through doorways with it and in cars. Eliminate the normal arm swing and cannot be used safely on stairs. Here you will see two different types of walkers. How to measure a walker. It's the same as a cane, where the hand grip comes approximately to the level of your greater trochanter, just a little bit lower than your hip joint, and then the elbow is slightly flexed when the hand is on the hand grip to an angle of 20 to 30 degrees. Prior to gait, the walker should be picked up and placed down on all 4 legs simultaneously, not the back legs and then the front legs. Instruct your patient to hold their head up, maintain a good balance, and caution not to step too close to the front of the crossbar of the walker, because then they can lose balance. So various different weight bearing that you can use a walker for is of course full weight bearing, partial weight bearing where you only place a certain amount of weight through the affected leg, and then of course non-weight bearing where you don't put any weight down through the affected leg. Here is some pictures for you to show you that there are other walking aids, mobility aids as well. Prior to discharge, teach your patient how to ascend and descend stairs or even a step. It will give them security and confidence to know that when they go home, they will be able to safely and successfully climb stairs. So a few considerations before we come to how you will teach them specifics. So here I'm going to talk about where will you stand while they are climbing stairs. When you go up, ascending, you will be standing posteriorly behind your patient and to the side of the injured side. A wide base of support is maintained with each foot on a different stair. So that is where your one foot will be on a different step to the other one, so that you can maintain a wide base. A step should be taken only when the patient is not moving. So while they are moving, you're not going to climb up or down. One of your hands should be placed posteriorly on their lower back or on a guarding belt, and one anteriorly, but not touching the shoulder on the weaker side. When your patient descends, go down the stairs, you have to be in front, anteriorly and laterally on the affected side. Also maintain a wide base of support, each foot on a different stair. A step should be taken only when the patient is not moving. One hand is placed anteriorly on the guarding belt and anteriorly but not touching the shoulder on the weaker side. Now the instructions you will give your patient. When you go upstairs, always tell them that the good leg goes up first, while the crutch and the affected leg remains behind. Then the next leg, and thereafter the crutches moves onto the step. Often you will find that the affected leg and the crutch moves very, very closely together, and you can't actually say good leg, bad leg, and crutch. But the same rhyme still is being used to teach ascending stairs with crutches by saying all good things goes to heaven first. So what is the best thing that your patient has? It's not the crutches, because eventually they want to get rid of the crutches and walk on their own independently. So the best thing, the good thing, is the strong leg. Then always the injured leg is still better than the crutches. The crutches in this context are the baddies, because that's what you eventually want to get rid of. So when you go down, when you descend with crutches on stairs, it reverses. The bad goes down first. So what is the baddie? What's the bad guy? They are the crutches. So crutches down first, followed by the affected leg, and then the strong leg. Try it at home, try it for yourself, and make sure you know how it works. There will also be a video guiding you. Just keep a lookout for the links that I will post for you. Some additional useful video clips you can find in this link. But be sure to look on Moodle for videos that will guide you to know how to practically perform all these. Especially make sure that you watch the video on how to move from sitting to standing by using your crutches, and then from standing back to sitting on a chair.